Hello, and welcome to the Reasonable Suspicion Testing Determination Training for Supervisors, brought to you by the U.S. Department of Transportation, Federal Transit Administration. When completed in its entirety, this training video satisfies the FTA training requirement to authorize transit supervisors and other transit officials to make reasonable suspicion testing referrals. Once trained, you are both authorized and obligated to remove safety-sensitive employees from duty when you observe signs and symptoms of probable prohibited drug use or alcohol misuse. You have an important role in preventing injuries and saving lives. Let's review our training agenda for today. We'll start by introducing the U.S. DOT and FTA testing regulations, followed by an overview of your role as a transit supervisor. Next, we'll cover prohibited drug use and alcohol misuse, with a focused discussion on each topic. Finally, we'll finish our training by discussing the reasonable suspicion testing referral process and watching some scenarios.
Today, we're going to discuss reasonable suspicion testing. Making the decision to refer someone for reasonable suspicion testing is not an easy thing to do, especially if you've worked your way up through the ranks with the same employees who you now supervise. How do you tell an employee, someone you've worked with for years, that you are referring them for reasonable suspicion testing? Today's training is going to give you the tools to do just that. As a supervisor, you are the eyes and the ears of the transit system. And the bottom line here is safety and saving lives. The Federal Transit Administration requires your employer to provide training to supervisors and other company officials to become authorized to make reasonable suspicion testing determinations. This is when signs and symptoms of possible prohibited drug use or alcohol misuse are observed. Today's training will define the term reasonable suspicion, describe the standards for making reasonable suspicion testing referrals, provide guidance regarding how to approach an employee whom you suspect may be impaired, and how to conduct a reasonable suspicion interview. Let's get started.
Let's jump into Section 1. In this section, you will get an introduction on the U.S. DOT and FTA testing regulations 49 CFR Parts 40 and 655. Upon completion of this section, you will be able to discuss the purpose of federally mandated testing in the transportation workplace, identify the applicable federal testing regulations and to whom they apply, define which job duties are safety-sensitive functions in transit operations, and recognize when testing is authorized under FTA rule. Following two fatal transportation accidents caused by employees impaired from illicit drug use and alcohol misuse, Congress responded by passing the Omnibus Transportation Employee Testing Act of 1991. The Omnibus Transportation Employee Testing Act aims to enhance safety in the transportation industry by mandating drug and alcohol testing for employees in safety-sensitive positions across various transportation sectors such as aviation, trucking, railroads, and public transportation. By removing violating employees from safety-sensitive duties, the Act combats drug and alcohol use among transportation workers whose actions impact public safety and mitigates risk that an impaired employee poses to the traveling public. The Omnibus Transportation Employee Testing Act requires the U.S. DOT to implement the regulations mandating the procedures for testing transportation employees. It also requires each of the DOT agency administrations to establish testing rules specific to their industry. These rules define things such as who is subject to testing and when testing is authorized within that industry. The U.S. DOT rule codified as 49 CFR Part 40 covers the technical aspects of the testing process, such as the type of specimens that are authorized for testing, how those specimens are collected and analyzed, the training qualifications for the service agents, the employee protections that ensure accurate and fair results, and the process for employees with violations to become eligible to return to safety-sensitive duty. (49 CFR Part 655) titled The Prevention of Alcohol Misuse and Prohibited Drug Use in Transit Operations is the transit-specific rule mandating drug and alcohol testing. This rule covers which agencies are covered by the rule, the transit workplace duties that are defined as safety sensitive, the prohibited substances and prohibited behaviors, the employee and supervisor training requirements, and the circumstances or thresholds that authorize and require the employer to perform FTA testing. Grantees and subrecipients of FTA funding that support transit operations must comply with both testing rules. Contractors who stand in the shoes of a funding recipient must also comply. Compliance with both rules is mandatory to receive FTA funds that support public transportation. Transit agencies that do not comply with the testing regulations may put future funding at risk. Not all transit agency personnel are covered by the FTA testing rule. Federal testing is only applicable to employees who perform safety-sensitive functions. Employers are prohibited from testing employees under the federal testing rule who do not perform FTA-defined safety-sensitive functions. Employees who perform any of these job duties are classified as safety sensitive and are covered by the FTA testing regulations. Operating a public transportation vehicle, including when the vehicle is not in service. Operating an ancillary vehicle that requires a commercial driver's license to operate. Controlling the dispatch or movement of public transportation vehicles. Performing maintenance on public transportation vehicles or equipment, or carrying a firearm as part of transit security duties. Keep in mind that an employee's job functions, not job title, determine if an employee is subject to FTA testing. These are the circumstances under which FTA testing is authorized and required. Pre-employment testing ensures employees are drug-free prior to their first performance of a safety-sensitive function. Random testing of employees acts as a strong deterrent against the employee's use of prohibited drugs or misuse of alcohol. FTA post-accident testing is required after an occurrence in which FTA thresholds have been met. The purpose of reasonable suspicion testing is to ensure that a trained official has the authority to remove an employee from safety-sensitive duties when they have observed signs and symptoms of probable prohibited drug use and/or alcohol misuse. Testing must be based on specific and current indicators that are related to the employee's appearance, behavior, speech, or body odor. The observations must be documented and must maintain on file with the employer for at least 2 years. When an employee has violated the U.S. DOT FTA testing program by testing positive on a drug test, producing a confirmed alcohol test result of .04 or greater, or by refusing to submit to testing, they are no longer eligible to perform safety-sensitive functions for any DOT-covered employer unless and until they have successfully completed the U.S. DOT's Return to Duty process. We've come to our first knowledge check. What was the goal of the Omnibus Transportation Employee Testing Act of 1991? Choose all that apply. To enhance safety in the transportation industry by mandating drug and alcohol testing for employees in safety-sensitive positions. To combat drug use and alcohol misuse among transportation workers whose actions impact public safety. To mitigate the risk that an impaired employee poses to the traveling public. All of these were the goals of the Omnibus Transportation Employee Testing Act of 1991 and continue to be the goals of the U.S. DOT and FTA. As a condition of receiving federal funds, transit agencies must comply with which of the following federal regulations? 49 CFR Part 655, 49 CFR Part 382, 49 CFR Part 199, 49 CFR Part 40, Transit agencies must comply with both the FTA Testing Rule Part 655 and U.S. DOT Procedural Rule Part 40. Which of the following job duties are considered safety sensitive under FTA rule? Choose all that apply. replacing brake pads on a transit bus. Teaching a customer service training class. Driving a transit bus through the bus wash. Giving turn-by-turn directions to a bus operator. Towing a 30-foot bus with a wrecker. All these functions are safety sensitive, except teaching a customer service training class. Now we'll discuss the role of the transit supervisor. For the purposes of this training, we use the term supervisor to mean any company official who has been authorized and trained to make reasonable suspicion testing referrals. Upon completion of this section, you will be able to describe the FTA training requirement for supervisors, identify transit agency personnel who should receive this training, and define reasonable suspicion under the FTA testing rule, and describe the role of the supervisor.
Hi, I'm Jared Jones, a road supervisor with Community Transit. We operate 10 fixed route buses and 5 paratransit buses. It's my job to make sure our safety-sensitive employees are professionally trained and comply with our policies and procedures. I'm a safety-sensitive employee myself. My duties include behind-the-wheel training and occasionally serving as a relief operator. I also respond to accidents and determine when the FTA thresholds for post-accident testing are met. Since my job duties include frequent interaction with our operators, dispatchers, mechanics, and other safety-sensitive employees, I have an opportunity to observe their appearance, behavior, speech, and body odor. That's why my agency has trained me to make reasonable suspicion testing referrals. The management team relies on me to make sure any employee exhibiting signs of impairment is immediately removed from safety-sensitive duties. I need to remain alert and vigilant. If a safety-sensitive employee is impaired and I miss the signs, there's no telling what could happen. It can cost someone their life.
Supervisors and other transit officials authorized by their employer to make reasonable suspicion testing referrals must first receive at least 60 minutes of training on the physical, behavioral, and performance indicators of probable drug use, and 60 minutes of training on the physical, behavioral, and performance indicators of probable alcohol misuse. Your employer determines which transit agency personnel become authorized and trained to make reasonable suspicion testing referrals. Good candidates for this training include any supervisor or company official who frequently interacts with safety-sensitive employees, as they are likely to notice changes in an employee's appearance, behavior, speech, and/or body odor, and are readily available to remove an employee from safety-sensitive duties when observations are made. Employers should ensure trained supervisors are available on all shifts and in all safety-sensitive departments. FTA's definition of reasonable suspicion is as follows. The determination that reasonable suspicion exists shall be based on specific, contemporaneous, and articulable observations concerning the appearance, behavior, speech, or body odor of the covered employee. A supervisor or other company official who is trained in detecting the signs and symptoms of drug use and alcohol misuse must make the required observations. Let's further define some of the key words in the FTA definition of reasonable suspicion. Specific means that you can state specifically what you have observed, such as bloodshot eyes or slurred speech, as opposed to a general observation such as acting funny. Contemporaneous means that your observations are current. You are seeing the signs in that moment. And articulable means that you can explain exactly what you have observed. The importance of ensuring that safety-sensitive employees are in no way impaired cannot be overemphasized. Failure to do so may have tragic consequences. The authority to refer an employee for testing before they perform a safety-sensitive function prevents injury, saves lives, and keeps the public safe. Supervisors are the eyes and ears of the transit system, and as such, employers and coworkers rely on them to intervene when an employee is unfit for duty. The FTA rule requires only one supervisor to make a referral for testing. Supervisors must not consider gossip, rumor, or hearsay when making testing determinations. The observations must be made by the referring supervisor, not based on second-hand information.
When I am called to the scene of an accident, my job is to determine if it meets the thresholds for FTA post-accident testing. Many accidents are minor and do not require testing. But even if I determine post-accident testing isn't required, my job's not done yet. As a supervisor, I need to carefully observe the driver. If I see any possible signs of impairment, I'll interview the operator to determine if a referral is appropriate. If I decide to refer an employee for reasonable suspicion testing, it must be based on specific and current observations of the employee's appearance, behavior, speech, and body odor. I can't make a referral based solely on gossip, a rumor, or a complaint from another person. It must be observed. Once I make a decision to refer an employee for reasonable suspicion testing, it must take place immediately, and I must fully document the observations that led to the referral for testing. The purpose of this training is to equip supervisors with the tools necessary to determine whether reasonable suspicion exists to require a safety-sensitive employee to undergo testing. We will review the signs to watch for and what actions to take when we suspect an employee might be under the influence at work.
Let's test your knowledge. Which of the following transit personnel should be trained and authorized to make reasonable suspicion testing determinations? Choose all that apply. Transportation supervisor, lead driver, scheduler, lead mechanic, dispatcher, safety trainer, Although your employer determines who is trained and authorized, all the transit personnel listed would be good candidates for reasonable suspicion training because they have frequent interaction with safety-sensitive employees. Which of the following are specific observations concerning an employee's appearance, behavior, speech, or body odor that may indicate impairment? Choose all that apply. Bloodshot eyes, acting funny, slurred speech, dilated pupils, insubordination, odor of alcohol on breath, acting funny and insubordination are not specific observations concerning an employee's appearance, behavior, speech, or body odor. Next, determine if you believe these statements are true or false. A trained supervisor has the authority to refer an employee for reasonable suspicion testing without needing to obtain approval from another company official or manager. This statement is true. A trained supervisor has the sole authority to make reasonable suspicion testing determinations and refer a safety-sensitive employee for testing. True or false? A trained supervisor can refer an employee for testing even if he or she does not have actual proof that the employee has used a prohibited drug. This statement is true. The threshold authorizing testing is reasonable suspicion based on the observations made by a trained supervisor. True or false? A trained supervisor can refer an employee for testing based on a rumor that the employee was drinking on the job yesterday. This is false for a few reasons. Referrals for testing cannot be based on rumor, gossip, or hearsay. Additionally, the observations must be made directly by a trained supervisor, and they must be contemporaneous, meaning that they are being observed in that moment.
If an employee is misusing alcohol or using prohibited drugs, they may show signs of impairment, which can be similar to the signs and symptoms that are caused by things such as fatigue, illness, or side effects from medication. It's not my job or yours to determine the exact cause of the signs of impairment that we are observing. Our job is to initiate reasonable suspicion protocols when we see signs of impairment. You just never know for certain. That's why reasonable suspicion testing is used to rule out drugs and alcohol as the cause of the signs you've observed. So what do you look for? There are various indicators that someone may be under the influence of drugs or alcohol. The biggest red flag is an observed change in the employee's behavior, attitude, or appearance. Reasonable suspicion must be based upon facts or specific circumstances that present a reasonable basis to believe an employee is using alcohol or other drugs. If you see a safety-sensitive employee showing any signs of impairment, implementing reasonable suspicion testing is appropriate and necessary.
In Section 3, we'll focus on the 5 prohibited drug classes included in the U.S. DOT and FTA testing program. Upon completion of this section, you will be able to identify the 5 prohibited drug classes. Describe the general signs and symptoms of prohibited substance use. Identify the indicators of drug use and alcohol misuse related to appearance, behavior, speech, and body odor. The U.S. DOT testing panel includes these 5 prohibited drug classes: amphetamines and the subclass of methamphetamine and the metabolites of ecstasy, cocaine and its rock form, crack cocaine, marijuana and various extracts including oils, resin compounds, and hashish. Opioids includes naturally derived opiates and the semi-synthetic opioids hydrocodone, hydromorphone, oxycodone, and oxymorphone. Phencyclidine, PCP in all its forms, pills, powder, or liquid. Unlike illicit drugs, alcohol is legal for those of us that are of legal age, and it is up to the employee to drink responsibly. FTA authorizes reasonable suspicion testing for alcohol misuse when observations are made just before an employee is to perform a safety-sensitive function, during an employee's performance of safety-sensitive functions, or just after an employee has performed a safety-sensitive duty. Safety-sensitive employees can be tested for drugs anytime they are on duty. We will cover the specific signs and symptoms of each prohibited drug class and alcohol misuse in upcoming sections. But here are some general signs of impairment that a supervisor may observe in relation to an employee's appearance, behavior, speech, or body odor. In the appearance category, profuse sweating, dilated pupils, constricted pupils, a flushed face, bloodshot eyes, glazed eyes, needle marks, and trembling hands are examples. In the behavior category, examples include the lack of motivation, poor decision-making, short attention span, bursts of energy, lethargy, poor coordination, slow reaction time, and jittery movements. An impaired employee might exhibit slurred or incoherent speech, or might be rambling or mumbling. The odor of alcohol in the breath or the smell of marijuana on their clothing may also be noticed. Here are some examples of the impact that an employee's substance use may have on the workplace. Increased absenteeism, tardiness, and sleeping while on duty all lead to loss in efficiency and costly mistakes. The employee's inability to focus on tasks causes inferior performance and increases on-the-job injuries. Poor decision-making and taking risks could lead to fatal accidents. They may be difficult to work with due to extreme mood swings. Most drugs in the prohibited classes can be administered in more than one way. Let's explore the different routes of administration and the equipment or paraphernalia used. Some drugs are taken orally as a tablet, capsule, or as an edible. Others are used intranasally or snorted. Inhaling is another route of administration, and this includes smoking, like a cigarette, vaping, or smoking through a pipe or bong. And the last route of administration is intravenously, which is to inject the substances into a vein. When administered by mouth, drugs do not immediately enter the bloodstream. Instead, they are absorbed more slowly from the intestinal tract, and some portion is broken down by the liver before it reaches the bloodstream. There is no specific paraphernalia associated with administering drugs by mouth. But if you see a safety-sensitive employee with tablets or capsules in an unlabeled container, you should monitor for signs of impairment. Although there can be some prescription medications that can be administered intranasally, there are no prescription drugs that are snorted as a powder. Nasal membranes are thin, and substances administered through the nasal passages pass into the blood without being processed by the liver first, as they would be with oral administration. The drug most commonly associated with this method of administration is cocaine. But several forms of the drugs that fall into the prohibited classes can be snorted, including heroin and other opioids. The user will crush or chop the drug to maximize absorption, and then use a razor blade, playing card, or credit card to form a line with the powder that can be snorted into the nose through a rolled dollar bill or straw. A faster way for the psychoactive ingredients in some drugs to reach the bloodstream and the brain is through inhalation. Inhalation produces a faster rise and faster fall in the levels of a substance's psychoactive ingredients. This method of administration has a far greater potential for addiction. Methods of inhalation differ within the drug classes, as does the associated paraphernalia. Glass pipes may be used to smoke crystal meth, crack cocaine, or PCP. Crystal meth and certain forms of heroin can be vaporized by heating the substance on aluminum foil and inhaling the vapors through a glass tube or straw. Rolling papers are used to roll the dry buds of the marijuana plant into a joint for smoking. Pipes, vape pens, and water bongs are also used for smoking marijuana. PCP is often consumed by dipping a cigarette or joint into liquid PCP and then smoking the laced cigarette. The fastest and the most potentially addictive and dangerous way to administer drugs in the prohibited classes is to inject a liquefied form of the substance directly into a vein. Many drugs can be dissolved in liquid and injected, including forms of cocaine, meth, and other opioids. A syringe is the only required paraphernalia for injection, but depending on the drug, other equipment may be needed to liquefy or dissolve the substance to prepare for injection. For example, heroin is heated in a spoon with a lighter, so the spoon will have scorch marks. If the syringes themselves are not present, injection of drugs may be indicated by needle marks or track marks in the arm. Needles may also be found with some other type of rubber tube or band to constrict the upper arm to make veins more prominent before injecting. While not specifically used as a tool for administration, there are some items that may be found among the belongings of those who use drugs, such as breath fresheners used to cover up the odor of alcohol or smoke that may be a sign of drug use. Eye drops and sunglasses used to hide bloodshot eyes and dilated or constricted pupils. Glass vials and small packages, candy wrappers or bags of candy, makeup bags, and plastic baggies are sometimes used to contain, carry, or hide drugs. It's time for another knowledge check. Which of the following drug classes are included in the DOT FDA testing program? Choose all that apply. Antidepressants, amphetamines, opioids, cocaine, benzodiazepines, antihistamines, phencyclidine, PCP, marijuana, SSRIs. The 5 drug classes that are included in the FDA testing program are amphetamines, opioids, cocaine, phencyclidine, and marijuana. It is allowable to test for alcohol anytime a safety-sensitive employee is on duty. False. An FDA reasonable suspicion alcohol test is only authorized when observations are made just before, during, or just after the employee's performance of a safety-sensitive duty. What is something that might be found in relation to someone covering their alcohol misuse or drug use while on duty? Choose all that apply. Breath fresheners, eye drops, sunglasses, glass vials, small packages. All of these items could be correlated with someone trying to cover their tracks. Remember, just because someone is using eye drops or breath fresheners does not mean they are using drugs or alcohol. Reasonable suspicion testing can only be referred based on specific, contemporaneous, articulable observations concerning the appearance, behavior, speech, or body odors of the covered employee. Now let's take a deeper dive into a discussion about prohibited drugs. Upon completion of this section, you will learn about the appearance and use of the 5 prohibited drugs, the short and long-term effects of using these drugs, as well as the signs and symptoms to look out for. Now, let's jump into the first of the 5 prohibited drugs, amphetamines. As previously stated, amphetamines are stimulants that can have a variety of slightly different chemical forms. This class also includes amphetamine derivatives, methamphetamine, MDMA, also known as ecstasy, and MDA, known as Sally. Amphetamines typically come in pill or capsule form. Users may obtain these illegally on the street or may obtain prescriptions such as Adderall, Vyance, or Benadryl that have been illegally obtained for sale. Amphetamines are most commonly taken by mouth or crushed and snorted. Methamphetamine is usually ingested as a white, bitter-tasting powder or a pill. Crystal methamphetamine is a form of the drug that looks like glass fragments or shiny bluish-white rocks. People can take methamphetamine by mouth, in tablet or capsule form, or by snorting or injecting powder that has been dissolved in water or alcohol. Crystal meth is heated and then smoked in a glass pipe. The effects or consequences of altered brain chemistry include a state of high alert, focused attention, a rise in heart rate and blood pressure, a release of glucose from energy stores, and an increase in blood flow to muscles to prepare the body for action. Pupils are also dilated. The body builds up a tolerance to the effects, and increasingly larger doses are required. Side effects can also include headaches, nausea, severe anxiety, lack of appetite, teeth grinding, rapid breathing and heart rate, dizziness, high blood pressure, and increased body temperature. Short-term effects include quicker reaction time, feeling of high energy and excitement, increased concentration and attentiveness, and feeling of euphoria. Long-term effects include racing thoughts, paranoia, violent behavior, craving for the drug, obsessive behavior, and hallucinations. Users can also experience a sensation of something crawling on the skin and respiratory problems. An observer may notice that a user of amphetamines or methamphetamines exhibits uncharacteristic talkativeness, fidgeting, and sweating, or may have dilated pupils, shaky hands, and difficulty concentrating. MDMA and MDA are synthetic substances that are chemically similar to amphetamines and hallucinogens. In addition to the increased energy and focused attention experienced with amphetamines, MDMA and MDA alter mood and distort sensory and time perception. It's most often consumed in tablet form. However, it is also sold in a crystalline form known as Molly that may be dissolved in liquid or snorted. MDA has similar side effects to MDMA but is rarely used. Effects of MDMA and MDA can include increased energy, empathy or feeling of closeness with others, reduced anxiety, increased emotionality, mild hallucinations, and altered sense of time, sensation, and perception. Short-term effects of MDMA and MDA include dehydration, hyperthermia, teeth grinding, increased heart rate and blood pressure, sweating, loss of appetite, nausea and vomiting, and diarrhea. Long-term effects of using MDMA at high doses have been shown to produce brain lesions, a form of brain damage in certain neural pathways. Long-term exposure has been shown to produce marked neurodegeneration in several structures in the brain. Next up in the 5 prohibited drug classes is cocaine. Cocaine is a strong stimulant extracted from the coca plant. It is very addictive and was once used as an anesthetic. It is occasionally used medically in a topical form to numb the lining of the mouth before certain surgical procedures. Cocaine primarily increases the levels of dopamine in the brain, similar to amphetamines. Cocaine is a crystalline powder and typically snorted, but it can also be taken intravenously. Another form of cocaine, crack cocaine, is derived from the powder form of cocaine. Through a complex process that combines it with water and another substance, usually baking soda, crystalline rocks are produced that are then smoked in a glass pipe. Side effects of cocaine use can include dilated pupils, vertigo, constricted blood vessels, tremors, muscle twitches, increased heart rate, increased blood pressure, and increased body temperature. Additional short-term effects include a sense of well-being, clarity, euphoria, and increased energy, which can give way to an unpleasant sense of restlessness and inflated self-esteem. Long-term effects can include headaches, abdominal pain, nosebleeds, weight loss, heart attack, stroke, seizures, and in some cases, death. Many of the signs of cocaine use are the same as the signs for amphetamine use. An observer may notice dilated pupils, uncharacteristic talkativeness, fidgeting and restless, jittery movements, shaky hands, moodiness, irritability, nose rubbing, and sniffing or nosebleeds. Next up is marijuana. Also known as cannabis, marijuana is a psychoactive drug from the cannabis plant. The primary psychoactive ingredient is THC. Marijuana also contains a variety of other substances called cannabinoids, which affects areas of the brain that control memory, coordination, perception, and judgment. Like many other drugs that have the potential for abuse, marijuana indirectly boosts dopamine in the brain's reward circuits. The severity of the effects depends on how much of the substance is consumed or inhaled. In low to medium doses, marijuana causes relaxation, reduced coordination, and reduced blood pressure. Physical effects of marijuana include elevated heart rate, bloodshot eyes, dry mouth, increased appetite, reduced memory and concentration, alerted senses, poor perception, and respiratory and sinus infection. Some examples of low or medium doses of marijuana include relaxation, reduced coordination, reduced blood pressure, attention problems, sleepiness, altered sense of time and space, and a sense of paranoia. Extremely high doses can include hallucinations, delusions, and memory problems, as well as disorientation. There are many different appearances and uses of marijuana. Dried flowers, leaves, are rolled and smoked like a cigarette, called a joint, or a cigar sometimes called a blunt, or in a pipe or bong. The term edibles refers to food or beverages that have been infused with THC. These are sold in dispensaries, where legal in certain states, or can also be made at home. When ingested by vaping, the psychoactive ingredient in marijuana is easily dissolved and can be used in vaping pens. This method has become increasingly popular. Resin extracted from the marijuana plant can be rolled into bars, sticks, or balls, typically called hashish or hash. Finally, hash oil is highly concentrated and is usually consumed by smoking, vaporizing, or eating. A user of marijuana may exhibit relaxed eyelids, glazed and bloodshot eyes, spontaneous laughter, and a strong, pungent smell on clothing or personal items. The next class is opioids. The term opioids refers to members of this class that are naturally derived from the opium plant, such as codeine, morphine, and heroin. The opioid class also includes the semi-synthetic opioids hydrocodone, hydromorphone, oxycodone, and oxymorphone. The opioids and semi-synthetic opioids are similar in structure and similarly fool the brain. They are highly effective in reducing pain, although they are similar to natural endorphins. These drugs don't activate nerve cells in the same way. They cause abnormal messages to be transmitted through the network. Physical effects can include reduced respiration, suppressing the cough reflex, constricting pupils, slowing digestion, increased urination, nausea, vomiting, constipation, and itching and sweating. In addition to relieving pain, calming and sedating increases the levels of dopamine in a way that procures the rewarding euphoric effects sought by people who misuse opioids. In medical practices, morphine can be prescribed for the short-term relief of moderate to severe pain. Morphine comes in several forms, including tablets, liquids, or patches. This includes codeine, that is mainly used to treat pain and coughing, but also can be commonly used as a recreational drug. Outside the medical field, heroin is one of the most potent illicit drugs and is illegal in all instances. It is sold as a white powder that is snorted or melted into liquid for intravenous injection. Black tar heroin is a sticky tar-like substance that can range in color from deep brown to black and is often heated on aluminum foil, and the vapors are inhaled through a tube. Opioid signs and symptoms include constricted pupils, lack of energy, lack of coordination, memory difficulties, difficulty staying awake, frequent scratching and injection marks. Signs of withdrawal can be different and look like irritability, mood swings, and a sudden onset illness. Repeated heroin use changes the physical structure of the brain, creating long-term imbalances that are not easily reversed. Heroin produces profound levels of tolerance and physical dependence and affects decision-making abilities and the ability to regulate behavior and responses to stressful situations. Symptoms of withdrawal include restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, cold flashes, and involuntary leg movements. And finally, we'll discuss phencyclidine, also known as PCP. PCP is a powerful and extremely dangerous anesthetic drug that induces hallucinations and feelings of detachment from one's surroundings. This causes disorientation and loss of bodily and mental control. Not only can PCP lead to mental health issues such as severe depression, it has also been linked to violent and aggressive actions, suicide, and accidental death. PCP was originally developed as a surgical anesthetic, but due to the unpredictable and extreme psychological effects, it was discontinued for human use. PCP reduces the action of the neurotransmitter glutamate, which plays a key role in learning and memory. It primarily targets the cerebral cortex and limbic system. The cortex is the most highly developed part of the brain and is responsible for thinking, perceiving, and language. The limbic system processes emotions, memories, and wakefulness. Effects include sight and sound distortion, detachment, sedation, amnesia, increased blood pressure, rapid heart rate, shallow breathing, sweating, and dilated pupils. PCP at different doses can have different effects. Low to moderate doses can give the feeling of detachment, slurred speech, numbness, and loss of coordination. In high doses, the effects include hallucinations and catatonic posturing, which is when a person assumes a bizarre posture and maintains it over a long period of time. Long-term heavy use can cause impairment in thinking and memory, anxiety, depression, and suicidal thoughts. PCP is a white, crystalline, bitter-tasting powder that quickly dissolves in water or alcohol and is also found in tablet or capsule form. Users may snort, smoke, swallow, or inject PCP. When taken by mouth, the effects are first felt within 30 to 60 minutes. When snorted, the onset is faster, from 2 to 20 minutes. When smoked or injected, the effects are felt almost immediately. The duration of the effects depends on the dose and the method of administration. The typical range is from 4 to 8 hours, with after effects being felt for up to 24 hours. A PCP user may exhibit profuse sweating, dilated pupils, incoherent speech, disassociation from reality, and temporary amnesia. Let's test your knowledge. Rolling papers can be associated with which drug class or classes? Antidepressants, amphetamines, opioids, cocaine, benzodiazepines, antihistamines, phencyclidine, marijuana, SSRIs. Choose all that apply. Rolling papers are most commonly associated with marijuana, but they are also associated with PCP. Users may spray and roll a variety of herbs for smoking. What signs can be associated with the use of cocaine? Choose all that apply. Dilated pupils, uncharacteristic talkativeness, jittery movements, shaky hands, moodiness and irritability, nose rubbing, sniffing, and nosebleeds. Typical signs associated with the use of cocaine include dilated pupils, uncharacteristic talkativeness, jittery movements, shaky hands, moodiness and irritability, nose rubbing, sniffing, and nosebleeds. Glass pipes, glass tubes, or other makeshift pipes can be associated with which drug class or classes? Antidepressants, amphetamines, opioids, crack cocaine, benzodiazepines, antihistamines, phencyclidine, marijuana, crystal meth. Choose all that apply. Crack cocaine, crystal meth, opioids, and PCP are all drug classes associated with glass pipes or tubes. What are the signs that are associated with the use of marijuana? Choose all that apply. Relaxed eyelids, glazed and bloodshot eyes, drowsiness, spontaneous laughter, and the strong odor of marijuana on clothing. Signs associated with the use of marijuana can include relaxed eyelids, drowsiness, glazed and bloodshot eyes, spontaneous laughter, and the strong odor of marijuana on clothing. Moving on to Section 5, we will be focusing on alcohol misuse. Upon completion of this section, you will be able to identify the alcohol prohibitions under FTA rule and when alcohol testing is authorized. Describe the difference between moderate drinking, binge drinking, and heavy alcohol use for both men and women. Define the short-term and long-term effects of alcohol misuse, and describe how long-term alcohol abuse impacts the body.
There was a time in my life when drinking was fun, but then drinking alcohol became a coping tool. And I soon found the need to drink just to deal with everyday life. Ironically, drinking alcohol led to relationship problems and financial issues, and it made everyday life more difficult, not easier. I promised myself I would never let it get to the stage of addiction, but it got out of control and I became alcohol dependent. Alcoholism and substance abuse don't have a common face. It is a universal disease that can affect anyone. Ask for help because it really can save your life. I enrolled in our employee assistance program to get help. It provided the confidential counseling and other resources I needed. Now I'm back on my feet and life is good again.
Under FTA rules, safety-sensitive employees are prohibited from consuming alcohol while on duty, while on call for duty, or within 4 hours of reporting for safety-sensitive duties. Safety-sensitive employees are also prohibited from reporting for duty with a blood alcohol concentration of 0.04. If an employee has a confirmed BAC between 0.02 and 0.039, they must be removed from safety-sensitive duties for a period of at least 8 hours or until subsequent testing confirms a result below 0.02 BAC. If an employee consumes alcohol while on call, they can acknowledge alcohol use at the time they are called to duty. When someone drinks alcohol, their degree of impairment is related to the person's blood alcohol concentration, or BAC. BAC is the measurement of the alcohol in the blood relative to the amount of blood in our system. Let's explore how BAC is measured, the level of impairment one may experience at varying BAC levels, and how long it takes the body to metabolize alcohol. Alcohol tests are administered using an evidential breath testing device, or EBT. The device uses a breath specimen to measure the alcohol content in the person's blood. The BAC is expressed in percentages. For example, a BAC of 0.10 means that there is 1 part alcohol for every 1,000 parts blood. The generally accepted definition of a standard drink is the amount contained in 1.5 ounces of a drink that contains 40% alcohol by volume. 1.5 ounces of a beverage that contains 40% alcohol by volume equals 0.6 of an ounce of pure alcohol. When you know the percentage of alcohol in a beverage, you can calculate how many ounces of the beverage will equal 0.6 of an ounce of pure alcohol. For example, beer averages about 5% alcohol by volume. The amount is 12 ounces. The calculation's fixed percent is 0.05. When multiplied, 0.05 times 12 ounces equals 0.6 of an ounce or 1 standard drink. Now that we have defined a standard drink, how many drinks would a person need to drink to have a BAC of 0.10? There is no one-size-fits-all. The concentration of alcohol in your blood after drinking a standard drink depends on how much blood you have in your system, and that depends on your gender and weight. Try out the Texas Alcohol Beverage Commission's chart called Know Your Limit shown here. This chart provides BAC estimates for the number of drinks consumed in an hour by gender and weight. Alcohol is absorbed into the bloodstream quickly and is broken down by the liver slowly. Effects of alcohol can be felt within minutes, and the duration and intensity of the effects depends on the BAC. With one standard drink, the effects may only last an hour. If you drink several drinks in a short time, your BAC rises quickly and will remain elevated for many hours after you finish your last drink. How long would it take for a person with a BAC of 0.10 to get the alcohol out of their system? To answer this question, we need to know how much alcohol a liver can metabolize in an hour. An average healthy liver reduces BAC by approximately 0.015 per hour. So for example, if a person had a BAC of 0.10 and didn't drink anything else, it would take 7 hours for their BAC to return to 0. Alcohol is primarily acting on reward and pleasure centers in the brain. This chart shows the common side effects at increasing levels of impairment. At 0.02 to 0.04, this is the beginning of a mild buzz, when a person acts happier than normal or more at ease. They also have slowed thinking and a slight numbness. Moving to 0.05 to 0.09 BAC, the impairment is noticeable at this level in things such as vision and hearing, reaction time, thinking rationally, and using good judgment. At the 0.10 and 0.14 level, multiple areas of the brain are significantly impaired, causing problems with speech, balance, and reaction time. Also, the ability to control impulses and emotions are affected. With a BAC of 0.15 to 0.19, all the effects of the lower levels are stronger, including unchecked emotions, impaired judgment, lack of motor control, and inability to speak clearly. Reflexes are delayed, and individuals may have trouble standing up. At 0.2 to 0.24, standing may no longer be possible, and the risk of severe injury is high. The person is likely to be dazed, confused, and disoriented. Many people will have intense nausea, and memory blackouts can occur at this level. When the BAC level reaches 0.25 to 0.30, the level of intoxication is dangerous. Automatic bodily functions are impaired, including breathing, heart rate, and blood pressure. The gag reflex inhibition can result in death by choking on vomit, or one can experience the loss of control over the bladder. At point 40, alcohol has turned off communications in the brain, and coma or death is possible. According to the Centers for Disease Control, excessive alcohol use is responsible for 140,000 deaths each year in the United States, shortening lives by an average of 26 years. 1 in 5 deaths among adults ages 20 to 49, and $249 billion plus in economic cost are attributed to alcohol misuse each year. Additionally, nearly half of all serious workplace accidents are caused by people drinking on the job. The U.S. Department of Health and Human Services defines moderate drinking as 1 drink per day for women and 2 drinks per day for men. Binge drinking is defined as consuming 4 drinks on a single occasion for women and 5 drinks for men. Heavy drinking is when binge drinking occurs on 5 or more days within the past month, according to the Substance Abuse and Mental Health Services Administration. Psychoactive ingredient and effects. Alcohol's psychoactive ingredient, ethanol, affects thinking, judgment, motor control, emotions, coordination, autonomic functions, and our senses. The degree of the effects depend on the amount of alcohol consumed. Alcohol can cause short-term effects, such as lowered inhibitions, and long-term effects, including weakened immune system. The impact of alcohol on the body isn't felt right away, but it builds in the system from the moment consumption begins. There are many short-term and long-term effects that alcohol has on the body. A few short-term effects are feelings of relaxation or drowsiness, a sense of euphoria or giddiness, changes in mood, lowered inhibitions, impulsive behavior, slow or slurred speech, nausea and vomiting, diarrhea, head pain, changes in hearing, vision, and perception, loss of coordination, trouble focusing or making decisions, loss of consciousness or gaps in memory, often called a blackout. Some long-term effects include persistent changes in mood, including anxiety and irritability, insomnia or other sleeping concerns, weakened immune system, changes in libido and sexual function, changes in appetite and weight, problems with memory and concentration, difficulty focusing on tasks, and increased tension and conflict in romantic and family relationships. Abusing alcohol has long-term impacts on the body. The risk of oral and esophageal cancers increases. Heavy alcohol use also increases the risk of developing dilated cardiomyopathy, enlargement of the heart. Alcohol abuse is the direct cause of more than 80% of all cases of chronic pancreatitis intake. Alcohol prevents the body from effectively utilizing useful minerals and not allowing the muscles to maintain their functionality. Persistent alcohol intake can impair the lining of the lungs and increase the likelihood of developing pneumonia due to weakened immune system. Excessive alcohol intake can cause the inflammation of stomach and intestinal lining. After prolonged periods of consistent alcohol intake, the endocrine system becomes less effective. Alcohol significantly impacts several regions of the brain. Let's learn more about alcohol's effects on the hippocampus, cerebral cortex, cerebellum, medulla, central nervous system, and hypothalamus. When alcohol reaches the hippocampus, it decreases the electrical activity of neurons by binding to specialized proteins or receptors that are embedded in the neuronal membrane. The decreased firing of impulses in the hippocampus disrupts the formulation of the short-term memory and accounts for the subsequent blackouts experienced the next day. Since memory is controlled here, long-term use can permanently damage the hippocampus, making it difficult to learn. Alcohol slows down the cerebral cortex as it works with information from a person's senses, leading to potentially poor judgment. Alcohol also depresses inhibition, leading one to become more talkative and more confident. Alcohol makes it harder for the brain areas controlling balance, memory, speech, and judgment to do their jobs, resulting in a higher likelihood of injuries and other negative outcomes. Long-term heavy drinking causes alterations in the neurons, such as reductions in their size. Alcohol can have a negative effect on the cerebellum, an area of the brain responsible for coordinating movement and learning. Alcohol can slow your reflexes or make you lose your balance. Prolonged or excessive alcohol use can cause atrophy of the cerebellum, a shrinkage of the brain that results in ataxia, a degenerative disease of the nervous system. Additionally, the cerebellum may have a role in regulating alcohol consumption, as some of its cells can inhibit or encourage drinking. Alcohol also affects the medulla, an area of the brain that handles automatic functions such as breathing, consciousness, and body temperature. By acting on the medulla, alcohol can induce sleepiness, slow breathing, and lower body temperature, which can be life-threatening. Alcohol is a central nervous system depressant. That means that it is a drug that slows down brain activity. This affects how signals flow through your body, making you think, speak, or move more slowly. It can change mood, behavior, and self-control. It can cause problems with memory and thinking clearly. Alcohol affects the hypothalamus, a small part of the brain that regulates many bodily functions. Alcohol can upset the work of the hypothalamus by altering blood pressure, hunger, thirst, urination, body temperature, and heart rate. Alcohol can also interfere with the hormone system that is controlled by the hypothalamus and the pituitary gland. This can affect blood sugar levels, reproductive functions, calcium metabolism, bone structure, digestion, and stress response. Often, the most prominent sign of alcohol use is the odor of alcohol in the breath. Many that misuse alcohol may try to cover this with mouth sprays and mouthwash. Signs of alcohol misuse also include slurred speech, lack of coordination, balance problems, and slow reactions. Memory lapses and lack of normal inhibitions are also possible. Some additional signs of misuse are bloodshot eyes, droopy eyelids, relaxed facial muscles, disheveled appearance, signs of a headache, and difficulty staying awake. Sudden and dramatic changes in behavior of an employee could be a sign of alcohol misuse. For example, a normally quiet employee may become loud or showy when under the influence. or a normally jovial and outgoing employee might become moody and argumentative. As a trained official, anytime you notice signs of alcohol misuse or impairment, you are obligated to remove the employee from safety-sensitive duties and initiate the reasonable suspicion testing referral process. Heavy alcohol consumption can lead to problem drinking. Problem drinking that becomes severe is given the medical diagnosis of alcohol use disorder, or AUD. AUD is a chronic relapsing brain disease characterized by compulsive alcohol misuse. A person experiencing AUD loses the ability to control their alcohol intake, and they become physically dependent on alcohol. They often exhibit a negative emotional state and symptoms of withdrawal. As a person loses control over their ability to choose the times and places they drink, they are more likely to drink alcohol within 4 hours of reporting for duty, and they are more likely to drink an excessive amount that would take many hours to clear their system. As they become more dependent on alcohol, they may even begin to drink while on duty. It is important to note that a liver damaged by drinking too much in the past will not process alcohol as efficiently as a healthy liver. The liver is the organ responsible for processing and storing nutrients in the body. Processing alcohol puts a strain on the liver, and at higher concentrations, alcohol damages the liver. When the liver is damaged, it tries to repair itself, and in the process, scar tissue forms. This scarring is called cirrhosis. When the liver is unable to clear alcohol from the system at a normal rate due to cirrhosis, the same amount of alcohol intake results in a much higher BAC and greater impairment. When it is necessary to make a referral, keep this in mind. For people who have a problem with alcohol, being referred for reasonable suspicion testing can be the first step in getting them the help they need. Many different types of interventions are available. These include Alcoholics Anonymous, AA, or other peer-led programs and professionally led behavioral treatments. The National Helpline is included on the screen, as well as the 988 Suicide and Crisis Lifeline. Another quiz challenge. Let's test your knowledge. If an employee has a confirmed BAC between .02 and .039, they must be removed from safety-sensitive duties for a period of at least blank hours or until subsequent testing confirms a result below .02 BAC. How many hours must that employee be removed for? 8 hours, 4 hours, 24 hours, 2 hours. The answer is the employee must be removed from safety-sensitive duties for a period of at least 8 hours if they did not choose to do subsequent testing, confirming a result below .02. Can you name at least 5 signs of alcohol misuse? Did you guess any 5 of these? Smell of alcohol in the breath. Slurred speech. Lack of coordination. Slow reactions. Talking loudly. Bloodshot eyes. Droopy eyelids. Disheveled appearance. What are the definitions of moderate drinking, binge drinking, and heavy drinking? Moderate drinking, up to 1 drink for women and 2 drinks for men per day. Binge drinking, 4 drinks for women and 5 drinks for men on the same occasion. Heavy drinking is binge drinking on 5 or more days in the past month. Which parts of the body are affected by alcohol abuse? Choose all that apply. Brain, lungs, heart, pancreas, muscles, stomach. All of these are correct. Alcohol misuse has lasting negative impacts on the body. Employees are prohibited from consuming alcohol within how many hours of the performance of safety-sensitive duties? 4, 6, 8, or 12 hours. The correct answer is 4 hours. True or false? An employee who consumes alcohol while on call for safety-sensitive duty has not violated the federal rule as long as they acknowledge their alcohol use when called for duty. This statement is true. If an on-call employee acknowledges the use of alcohol when called for duty, but claims that he or she can perform their safety-sensitive duties, the employer must first perform an alcohol test. Section 6 will focus on the reasonable suspicion testing referral process and scenarios. Upon completion of this section, you will be able to approach an employee when you have observed signs of possible impairment, conduct a reasonable suspicion interview, document your observations, refer an employee for reasonable suspicion testing, describe real-life reasonable suspicion scenarios. The first step in this process is observation. Observation is an ongoing activity. Remember to always remain vigilant for signs of possible drug use or alcohol misuse in safety-sensitive employees. The reasonable suspicion process begins as soon as you've noticed specific signs of potential impairment related to an employee's appearance, behavior, speech, or body odor. Once the observations are made, approach the employee without delay. The most important part of the process is preventing an impaired employee from performing duties that may jeopardize the safety of others. Approach the employee in a respectful manner. Be discreet, and ask the employee to accompany you to a private area where your conversation cannot be overheard by other employees, preferably behind closed doors where you and the employee can be seated. You might begin by simply asking the employee how they're feeling today. Use a calm tone of voice and describe the observations you've made and how you're concerned about the employee's fitness for duty. Do not attempt to diagnose the employee's condition, and do not accuse the employee of using drugs or misusing alcohol. Give the employee an opportunity to respond to your concerns. Listen while the employee responds to your concerns. Anticipate that the employee may become defensive or argumentative. Remain calm and stay on point. Acknowledge the employee's response and explain that the reasonable suspicion testing process is used to rule out that the observations you have made stem from drug use or alcohol misuse. Document the signs and symptoms that you observe, the time that the observations were made, the employee's response to your observations, and, if relevant, the behavior of the employee during the interview. Here is an example of a reasonable suspicion form to be used on employees, available on the FTA website, that clearly outlines everything that needs to be documented when making one of these referrals. The referral itself is the conclusion of your interview. Remember that reasonable suspicion testing is used to rule out drug use or alcohol misuse as a cause for the observations you've made. Explain the next steps in the testing process. For example, you'll be transporting them to the testing location now. Address any questions they may have and confirm their understanding. Once a referral for testing is made, testing must take place as soon as possible. For the employee's own safety and the safety of others, they should be escorted to the testing location. If you are referring the employee for both drug and alcohol testing, the alcohol test should be completed first. If alcohol testing is delayed more than 2 hours from the time that the observations were first made, you must document the reason for the delay. Cease attempts to perform an alcohol test if 8 hours have passed. Documentation must be maintained by the employer for at least 2 years. However, if the test results reveal a violation, the documentation must remain on file for at least 5 years. If the reasonable suspicion test reveals a positive drug test and/or alcohol violation, the employee must immediately be removed from safety-sensitive duties and provided a list of DOT-qualified substance abuse professionals for evaluation and treatment. The violating employee must complete the U.S. DOT's return to duty process before resuming safety-sensitive duties for any DOT-covered employer. Please do not be discouraged if prohibited drug use or alcohol misuse is not revealed through the testing process. Your decision to take action when you observed signs of possible impairment was appropriate to keep all of us safe. Next, let's watch videos of several reasonable suspicion interaction scenarios. The following scenario provides an example of how to conduct an interview after observing signs of impairment.
Hey Sam, just checking to see how the repair on vehicle A32 is coming along.
Look, I'm going as fast as I can. Joe was supposed to have this finished yesterday.
Sam dropped his tool and appeared to lose his balance when trying to pick it up. These are signs of possible impairment noticed by Sarah. Although it appears that there's no one else in the maintenance area, someone could enter at any moment, and Sam's right to privacy must be respected. Any discussions of Sarah's observations or intent to refer for reasonable suspicion testing must take place in a private location where the exchange cannot be overheard.
So how was your brother's birthday party over the weekend? Did you have a good time?
Yeah, it was a lot of fun. Maybe too much fun, if you know what I mean.
Listen, Sam, the reason I asked you to come into my office is because a few minutes ago, out by the bus, you looked a little unsteady. Are you feeling okay?
Yeah, I'm fine. My allergies have been acting up, so I took some Benadryl this morning. That's probably what it is.
After calmly inviting Sam to her office, Sarah started with small talk, which gave her an opportunity to see Sam close up and determine if there are visible signs of impairment in his appearance. During the conversation, Sarah noticed that Sam's eyes appear to be glassy and red. These observations, along with the lack of coordination exhibited when he dropped the tool and lost his balance, are specific and current signs of impairment shown by Sam's appearance and behavior. Because Sarah knows it's not her job to determine if Sam's impairment is caused by drugs, alcohol, or the medication he has taken, she will document the circumstances and observations and refer Sam for reasonable suspicion drug and alcohol testing.
My allergies have been acting up, so I took some Benadryl this morning. That's probably what it is.
Okay. I can understand how that could be the case. I know that stuff really affects a lot of people. But here's the thing, Sam. I'm noticing that your eyes are glassy and red, and I saw you lose your balance when you went to pick up the tool that you dropped. Although this could be side effects from allergy medication, I'm going to need to refer you for reasonable suspicion testing, just to rule out drugs and alcohol as the cause of what I've observed.
This is ridiculous. All I did was take some allergy medication. I'll call him Roger, my union rep. I need someone on my side. You guys are always trying to find ways to mess with me.
Sam, that's fine. You can call Roger, and I'll step out for a few minutes to give you some privacy. But just so you understand, the referral for testing is going to move forward. Roger's not in today, and I'm not permitted to wait until he's available.
Whatever. This is crazy. Do what you gotta do. I was planning on quitting this job anyway.
Okay, Sam. But just as a reminder, the policy you received when you were hired explained that you were subject to reasonable suspicion testing. I'm a trained supervisor, and it's my job to make sure that safety-sensitive employees are fit for duty. If your signs and symptoms are from allergy medication, the situation will be quickly resolved through testing. I'm going to give Lisa Moore a quick call. She's our agency's drug and alcohol program manager, and she'll arrange for the testing, and then I'll take you to the testing site. So give me just a minute. I'll be right back with Lisa.
Hey, you know what? Never mind. I'm quitting.
That's your decision. But you have to understand that your refusal to submit to testing does have consequences. It's the same as a positive result, which means you're not going to be eligible for another safety-sensitive position until you go through the USDOT's return to duty process. Why don't you let Lisa explain further, and then you can make your decision.
Sarah did well and remained calm and direct throughout her interview with Sam. She acknowledged the reasons Sam offered for the signs of impairment, and she made sure to explain the test is required to rule out alcohol misuse or drug use. Sarah did not allow the situation to escalate, even though Sam became defensive.
The next scenario demonstrates how to protect the employee's privacy when conducting an interview.
Morning, Tony. How's it going? What route am I running this morning?
Hold on a minute, Taylor. I need to have a quick word with Matt.
Hey, Matt. I think I smelled a bit of alcohol in Taylor's breath. Did you notice anything when you were talking to her this morning?
No, sorry.
Every candidate for reasonable suspicion testing has a right to privacy. When Tony raised his suspicion about Taylor with Matt, who is not a trained official, he violated that right. Credible information about a safety-sensitive employee spontaneously offered by another can be considered, but only as grounds for monitoring the employee more closely yourself. You must never raise or discuss your suspicions with another employee. The only exception is if you opt to consult with someone who has been trained and is authorized to make reasonable suspicion testing determinations. If you do choose to consult with an authorized colleague, make sure your discussions cannot be overheard. Now, let's look at another scenario. The situation is the same. Tony noticed the smell of alcohol when Taylor checks in with him.
What route am I running this morning?
Hey, Taylor, before I give you a route, can I have a word with you for just a minute? Can you step into my office?
So, how's it going? How's your dad doing?
He's doing okay. He had his last chemo treatment on Tuesday.
Oh, really? That's good.
Mm-hmm.
So, Taylor, the reason why I wanted to speak with you privately is because I'm getting an odor of alcohol coming from your breath. Have you been drinking?
No, I'm perfectly fine.
Okay, but the problem is I'm getting a strong odor of alcohol coming from your breath, and your eyes look glazed over as well. I just want to make sure that our passengers are transported safely, so I'm going to have to refer you for reasonable suspicion testing.
What are you even talking about? You're not even my direct supervisor. You can't do that.
Actually, I have been trained and authorized to make these kind of decisions. And I can't ignore what I've smelled. Although I'm not your direct supervisor, I am the person that drivers report to each morning to make sure they don't get behind the wheel if they aren't fit for duty. Look, the drug and alcohol program manager doesn't arrive till 8, so I need you to go wait in the break room, and I'll come get you when Catherine arrives, and she'll take you for the test.
Fine, whatever. You know what? How about I just leave and go home then?
It's not a good idea, Taylor. You reported for duty this morning. If you didn't think you were fit for duty, then you shouldn't have come in. I'm sorry, but this is the way it has to be. Please go wait in the break room.
Once a trained official has determined that a reasonable suspicion test is necessary, the testing should not be delayed pending a second opinion or the arrival of another company official. Internal processes and training should ensure that supervisors have the tools they need to perform testing as soon as possible after a reasonable suspicion determination has been made. To ensure the employee's safety, you should escort them to the testing location or arrange for another authorized personnel to take them for testing. If alcohol misuse is suspected, alcohol testing may only be performed when the observations were made just prior to, during, or just after the employee's performance of safety-sensitive functions. Now, let's watch the end of the interview and see how Tony makes the referral correctly.
Actually, I have been trained and authorized to make these kind of decisions. And I can't ignore what I've smelled. Although I'm not your direct supervisor, I am the person that drivers report to each morning to make sure they don't get behind the wheel if they aren't fit for duty. I'm going to call our testing provider who will come on site to perform the testing. Do you have any questions before I call them?
No, I understand.
Okay, hang out here for a minute while I make the arrangements. Okay, Taylor, the arrangements have been made. You can wait here in my office and I will come get you when the testing provider arrives.
The final scenario illustrates another example of a reasonable suspicion interview.
I'm glad to see you're okay, Kevin. There were no injuries, thank goodness, and both vehicles are drivable, so this accident doesn't meet the thresholds of FTA post-accident testing.
All right. That's a good thing.
Are you okay, Kevin? Did you hit your head, or do you need medical care? I'm concerned because you don't seem like yourself.
No, I didn't hit my head. I'm okay, just a little shaken up. I would just like to go home, and I don't think I can finish my shift.
Okay. Well, the police are wrapping things up here. I'll take you back to the office.
Although Kevin lets Amy know that he was not hurt in the accident, he appeared disoriented, slow, and his speech was slurred. These could be possible signs of impairment and should require further investigation. Although the accident itself did not meet the requirements for FDA post-accident testing, Kevin can still be referred for testing if there is a reasonable suspicion of impairment.
Thank you for sitting down with me. I just want to make sure you're okay.
Yeah, I know. I just want to go home.
I've known you for a long time, Kevin, and I've never seen you look so disoriented, and it seems like your speech is slurred. Have you taken any medication?
No, no medication. It's like well, I just want to go home and go to bed.
During the conversation between Kevin and Amy, Kevin continued to exhibit disorientation, and his speech was slurred. The unusual pauses in his answers are signs that he is having difficulty concentrating. These signs of impairment Amy is witnessing require a referral for reasonable suspicion testing. Although the signs could have another cause, the possibility of Kevin being under the influence of drugs or alcohol must be ruled out. Let's watch Amy refer Kevin for reasonable suspicion testing.
I'm sorry, Kevin, but unfortunately you can't go home yet. I'm concerned about what I'm seeing here, and it's my obligation to consider if this change in behavior could be due to drug use or alcohol misuse.
Huh? I don't understand. Come on, it was just an accident. I want to go home and go to bed.
I'm sorry, Kevin, but I'm going to have to transport you for testing. Do you understand why I need to do that, and do you have any questions?
Well, I guess I do. What if I don't agree? I thought you said the accident didn't meet the criteria for testing me.
That's right. But the accident isn't what's prompting testing. I'm making a reasonable suspicion testing referral because I'm observing signs and symptoms that could be indicators of drug use or alcohol misuse. It's my obligation as a trained supervisor to carry out testing when I see these indicators. It's important for you to know that if you refuse to take the test, it constitutes the same action as a positive test result. Do you understand the severity of this?
Yeah, okay. Whatever. Let's go.
These were just a few scenarios of situations you could encounter when dealing with reasonable suspicion testing. It is important to stay vigilant and trust your gut when it comes to dealing with reasonable suspicion. Remember, these referrals prevent injury, save lives, and keep the public safe. Assistance is available for those who may be struggling with substance abuse. Contact the Substance Abuse and Mental Health Services Administration by calling the number on the screen or by visiting the web address shown on your screen. You may alternatively call or text the 988 Suicide and Crisis Lifeline. Thank you for completing this training. You are now authorized to refer employees for reasonable suspicion testing. For additional information regarding the FTA drug and alcohol testing regulations, visit FTA's Drug and Alcohol Program website shown on your screen.